You're listening to the Modern Vital podcast, which explores the relationship between environmental factors and human health. Here is your host, Dr. Ben Reebs, founder of Portland Clinic of Natural Health and Modern Vital, elevating health and well-being one journey at a time. Stay tuned for fun, practical, and thought-provoking health tips, along with suggestions and insights into optimizing health and preventing chronic disease through integrative, naturopathic, and functional medicine approaches. Your body is unique, powerful, and intelligent. Your treatment should be too.
On today's episode of the Modern Vital podcast, we're going to talk a little bit about Epstein-Barr Virus, or EBV, and today's special guest is Dr. Kasey Holland. Dr. Kasey specializes in complex and chronic cases, often related to what she calls the toxic trio: Epstein-Barr virus, Lyme disease, and mold illness. And her specialties include chronic fatigue, Epstein-Barr, stealth infections, mold illness, environmental toxins, digestive issues, and hormone imbalances. Dr. Kasey's licensed in Montana as a naturopathic doctor, as well as Alaska, California, and Colorado. And she sees patients currently at her clinic location in Big Fork, Montana, as well as on telehealth for the other states. And she's an active member of the Montana Association of Naturopathic Physicians and the National Association of Environmental Medicine. And in her free time, she enjoys playing volleyball, hiking to alpine lakes, and traveling with her husband and dogs, Ranger and Glacier. Welcome to the show, Dr. Kasey.
Thank you, Dr. Reebs. Thank you for having me. I'm really looking forward to chatting with you today.
Yeah, well, Epstein-Barr is the topic, and I know it's something near and dear to your heart, and you're a world-leading expert in it. So what is Epstein-Barr?
Yeah, Epstein-Barr virus has gotten a lot more attention kind of recently, which is good. And it's a herpes family virus. So it's an opportunistic infection. Viruses from the herpes family, when they enter our body, which most of us have been exposed to them, I think it's estimated that there's greater than 95% of us that are going to get EBV. What you commonly will think of it as mono. Typically, kids getting it, a lot of times it's pretty self-limiting and resolves on its own. So that's the virus that causes that. And these viruses stay in our body. So it's not like a bacteria infection where, we can kill it and get rid of it. It stays there. So what can happen, as I'm sure we'll talk about in a bit, is that it can turn back on and be active. Our body should keep it inactive and we should be symptom-free, but it can be in an active state.
Got it. Yeah, I mean, I know we know it classically as an opportunistic infection that can kind of come on, if it can, or if the opportunity is presented. I assume that that's also the case in our youth, which is, as you mentioned, when we have it most commonly. It happens to 95% of us in our childhood or adolescence. So why has it become more of an issue lately, would you say?
I think part of it is that we are actually testing for it more, and there's a lot of awareness. I know that I guess it's been about 5-6 years, Medical Medium wrote a book about Epstein-Barr virus and attributed it to so many problems, and people started to ask their doctors to test them for it. And I think that doctors started testing more. We started seeing more of it. And then it got a lot of attention this past year because there was new research coming out that showed that it is directly associated with multiple sclerosis in a more intimate way than we originally thought, where there's actual transcription factors that increase the risk of multiple sclerosis that Epstein-Barr virus has that other viruses don't. And then also with COVID-19, we saw long haulers, and they started to test more for it and found that there was an increased association with long haulers and Epstein-Barr virus. So that's kind of why I think it's getting more recognition. Why it's more of a problem these days, I think, is a deeper issue. Anything that causes oxidative stress in our body, which is an imbalance of, we have these really amazing antioxidants, think of glutathione, that go around and help clear out stress. And stress can be toxins, and it can also be emotional stress. So anything that can cause that, and there's a lot in our world, can build up, and we have an imbalance of antioxidants to those toxins. We have oxidative stress, and Epstein-Barr virus, it's like a trigger. When that oxidative stress is there, it triggers that to be active. And I think as a society as a whole that we have more exposure to that in processed foods, daily stressors. The pandemic was stressful for people, so we're just seeing an increase in susceptibility in that regard too.
Fascinating. I know one thing that we often run, and I'm assuming you probably do, is some version of looking at the natural killer cells, the lymphocytes that are kind of responsible for protecting us from viruses and even cancer. And we often see these natural killer cell counts will diminish in tick-borne illness and in mold illness. And then, of course, it sets one up for Epstein-Barr virus to kind of come in because it's a virus. I'm curious what your thoughts are about that in conjunction with this oxidative stress piece.
Yeah, I think anytime that the body has a lot of infections, that our natural killer cells can start to be low. And sometimes I catch it with a simple CBC looking at white blood cells. And if I see somebody and their white blood cells are low, which I do see, or I'll see, oh, they're at the low end of normal and they've been that way for the last year and nobody's looked into why that is. And I think that definitely having chronic infections, whether it be EBV or other ones, a lot of times if your EBV is positive, it's a sign that there's so much more going on and that your immune system might be in a more suppressed state.
I want to talk to you a little bit about the testing because I know there's so much debate and really the science is sort of there, but there's also this gray area. And we often, as naturopathic doctors, have to look at the whole case. But anyway, with like an Epstein-Barr panel, we see at least 3 or 4 different antibodies. We see the IgG for the viral capsid and the nucleus. And then we also see, obviously, the IgM for the viral capsid. And then we have this early antigen one, which I know that people debate in various communities. But we know that generally it means there was a reactivation, or at least cells are being made for the virus, or replicating, I guess, in the last probably 3 months to 6 months, depending on who you talk to. But I'd love to hear kind of your approach. And also when it comes to the numbers, when we see, there's high levels above 600 to IgG viral capsid versus levels of 200. Like, how do you piece it together? Obviously, we're not giving medical advice here, but I'd love to hear your take.
Yeah, I have a personal history with Epstein-Barr virus and being exhausted, trying to get through medical school and not having anybody listen. And then I kind of just, I hate to say it, but I went with it. I said, okay, I'm just tired because I'm stressed and I better get more motivated. And then I had a patient in the teaching clinic and they had the same symptoms and I knew what they were feeling. And the only thing positive on all their labs was really high EBV titers. So that's what really, that was the kicker for me of this is not my imagination. And that was when I was in school. So the way that I look at it, there's really obvious things like your IgM are your official, there's an infection, they go, and that's your initial response. And if that's positive, well, usually that means, okay, there's definitely an active infection. That's supposed to not last for a long time. I will say in chronic cases, I do see it happen, especially with mold, and we can talk more about that if we have time. And then, so that's the easy thing. If that's positive, you've got an infection. Then you have your IgGs, and that's to the viral capsid and then the nuclear antigen, because the virus has an outer shell and then its inner parts. And if that is positive, it's well, is it still just responding to a past infection? Because these are your soldiers cells coming in. And then the early antigen. The early antigen is usually positive if you've had it before. So you have had IgM, your IgGs are positive, and then this guy is a nice marker to say, okay, it's gone from a latent to an active state. The problem is that usually only lasts for about 3 to 6 months. So you can have patients that the IgM is negative, the early antigen is negative, but they don't feel well. And then you have these IgGs. Normally, if IgGs are 10 times greater than normal and the patient is symptomatic, then I say, okay, you most likely have a high viral load and we're going to address it. If somebody had, a little elevated IgGs, they didn't have symptoms, then it's probably just still that immune response that's normal. So a lot of this and through treatment is looking at how the patient is feeling, because we still don't have our immune systems completely figured out. They are so complex. So we don't always know when the antibodies are going to completely shift and do what we want them to do or what we think they should be doing.
Fascinating. Yeah, I know you and I were talking a little bit about this, but many doctors have kind of an Epstein-Barr protocol that they use, or or they use maybe even conventional methods like acyclovir or what have you, or I guess monolaurin would be the more appropriate one, depending on what type of herpes you're treating. But anyway, what I often see is that these protocols may help a little bit, but then they don't really get the deeper issues, because so often it seems almost every time there's at least a deeper issue under the scenes, whether it's a tick-borne illness or an environmental toxicant or a mold illness or something like that. I'm curious how you approach that and what your sort of strategy is.
I never say never or always in medicine, but I can pretty much say I've never seen somebody come in and the only problem be EBV. And that if we just give them an antiviral, whether it's herbal or pharmaceutical, that will take care of it. And I think what's happening is that patients are so sick and they're so desperate for answers. And now doctors are finally running this test more. So they get that positive. And then both the doctor and the patient kind of thinks this is causing everything and this will fix all my problems. And unfortunately, it's much more complicated than that. And so I assess everything from your environmental toxin load to your stress load to other infections, gastrointestinal health, and hormones. Those are kind of the big pillars, and mitochondrial health, which is a whole other topic in and of itself. But really, if you have EBV positive, I almost see it more as a symptom now than this is root cause. And it allows me to say, we need to do further investigation and see what's going on. You might feel better with some of those protocols because it might help knock the viral load down. But then what happens is if you stop it, you have the same symptoms. Or some patients, I see them spending a lot of money on supplements and even higher level therapies like IV vitamin C, which are amazing therapies. But if we haven't dealt with the toxins like glyphosate, heavy metals, or you're still living in mold, you don't really feel better. And so it might be beneficial. It might be supporting, protecting further dysregulation from happening, but it's not going to get you back to, functioning the way that you want to.
So what I'm hearing from you then is that it really depends on the individual, and you don't have, you've got your tools in your toolbox, but you don't have, or do you? Do you have like one or two things that you'll probably use with that Epstein-Barr patient, but just you're going to tweak it or tune it or adjust the dosage depending on what's behind the scenes?
I would say from my perspective, what I always use, and I will say always unless there's an allergy or some other reason, but usually is antioxidants, glutathione and curcumin. And the reason for that is, so when Epstein-Barr turns on, I'm kind of being like, it's not just Epstein-Barr, but Epstein-Barr is a big deal. We got to deal with it. It turns on inflammatory pathways that are associated with autoimmune conditions, cancers. When it turns that on, we need to combat what's happening. Curcumin's really good at doing that. And glutathione, because of what I was saying about oxidative stress, I know that you are dealing with more so to help your body with that. And now how we dose that and everything can be dependent on the person. So those are my go-tos. I would say that as far as antiviral wise, it really depends on the patient. I do use pharmaceutical antiviral medication. It can really help, especially if it's the more acute situation where somebody was acutely ill or whatnot. It can really help get that under control. I do use the herbs, but normally just one of those things alone is not going to be enough.
Are you willing to share which antiviral medications you see work the best?
Some people have had, like, some people have a prescription on file because they already have herpes 1 or 2 as well with it, because it's the same family. And if they're already using that, then we'll just kind of use that. So like acyclovir, valacyclovir, there's some minor variations there. There are some that are coming out that are supposed to be more targeted towards it since COVID-19 happened and everything. And I usually use valacyclovir is what I usually use.
Well, I know that you had mentioned the mold illness piece, and then of course you mentioned this toxic trio with Lyme disease and tick-borne illness. And I think we know that Epstein-Barr and Lyme can present in very similar ways with joint pain and muscle pain and fatigue and brain fog. And I think one key thing they seem to share in common is this adaptability, kind of this ability to change and shift depending on the person and their weakness. For example, we know that the Epstein-Barr can go into the epithelial cells or the B cells after that, like the antibody-producing cells. We know that Lyme can pretty much go everywhere and throw a party. Anyway, I'd love to hear your take, or how you sort of found yourself working with all these things.
I think that first it was. So I heard this quote one time, and it was like, how do you find your purpose? This pastor was talking about, how do you find your purpose? And he said, what do you hate the most? Go do something about it. You'll never be, you'll always have fuel. And since I was little, my mom bought me like pathology textbooks when I was 8. I had to figure it out. I don't like to see people suffering, and I don't like to not have an answer for it. That's just who I am. And when I was suffering and it was impeding me from being able to do my job and help people, and I didn't have the answer, and I was about to be a doctor. And then I saw so many people. Part of it is just conventional medicine in general, because I was very passionate about that way before. But really it just comes down to why do we need to continue doing things that don't work? We're giving people false hope. We're labeling viruses and making them into something that this Epstein-Barr virus is causing all these symptoms. And I'm so thankful that Epstein-Barr is getting more attention now, because before it was like, oh, that doesn't do anything. In my residency in Atlanta, Georgia, every single patient that came to this big clinic would have a viral panel done. And I would see, oh my goodness, so many people have these viral loads, and this would have never been tested. That was about 5-6 years ago. So that would have never been tested at a routine visit that time. So really, I just want to help people get better faster. And I want to make sure that the therapies that we're doing make sense. And a lot of times we can be thinking that we're helping patients because, we're giving them this and this treats a virus. But it's really nearsighted, and that might not be what their body really needs to overcome that virus. And so really it's just about being curious and wanting to really get to the actual root causes. And sometimes we have to dig deeper. And I think we're at a point in medicine where that's very true. We just have, we have more exposures, we have more stress, and we need to really think about what our treatments are doing for patients and what the goal is to restore somebody to their body doing what it's supposed to, not being reliant on medications to be able to function throughout the week.
Right. Yeah. And you bring up a great point too about this kind of viral load. And then of course we know about the total toxic burden and how it just grows in these other illnesses like mold and Lyme. And then it makes Epstein-Barr more likely to kind of come in, throw a party, and make it even worse. Well, thank you so much, Dr. Kasey, for your time today. Where can people find you online? Like, where do you live on social, or what's your website?
Yeah, I'm on Instagram. My handle is Dr. Kasey Holland, and then my website is drkaseyholland.com too, and it's Kasey with a K. But that's where you can find me.
Great. We'll make sure to link to all of that.
Thank you for having.
Thank you so much for coming on. That concludes today's episode of the Modern Vital podcast. We'd really love to hear from you. We value your feedback. And if you have any questions or suggestions, please reach out to me at ben@modernvital.com. Also, please leave us a review if you enjoyed this episode. And we look forward to having you join us next week for another exciting episode of the Modern Vital podcast.